Hi, I'm Raphael, and welcome to Ask Me Anything for today, the 23rd of October, 2020. A couple of public service announcements to begin. Firstly is that this is available as a podcast. So if you're watching on video, you can continue to do so. But if you prefer to listen, you can head over to your favourite podcast app, whether that's the Apple Podcasts app or Google or Spotify or any of the others, and you'll find us there. Just type in Ask Me Anything. And also that I have another podcast with my friend and colleague, Chloe Bunter, called Pilates Elephants. So if you're interested in Pilates, we unpack the myths and misconceptions, the elephants in the room in the Pilates industry. And that is weekly, and that is also on all major podcast platforms. Pilates Elephants. And final PSA for today, I'm very excited that we have now this week launched our new clinical diploma. So it's a diploma of clinical Pilates. It is 100% online. It's an internationally recognised Australian government accredited course, and it's for you if you're a Pilates instructor with at least a couple of years experience teaching and either mat or reformer or both, and you really want to take your knowledge of anatomy, biomechanics, and the whole clinical side of things to a deeper level. It's a full year course, and you'll find all the details on our website, which is breathe, breathe.edu.au. So that is all the PSAs for today. Let's get into the questions. First one comes from Cassie, and Cassie says, "Hi Raphael, I have a question about Pilates as an exercise modality for Parkinson's disease, and more specifically, if you know of examples of stage 4 Parkinson's disease using Pilates exercises. Thanks, Cassie." Well, Cassie, I did some digging and I found some good news, basically. So I found 3 systematic reviews, and the first one was from 2018, and it was it examined exercise for Parkinson's disease, and they had 2 conditions. One where they used an external cue, another one where they gave no specific cue or an internal cue, and the final one where there was no exercise. And what they measured, the outcomes in this systematic review, where they looked at studies that measured walking speed, average walking speed, maximum walking speed, sit to stand time, step length. And what they found was that basically the external cue condition was superior to both the non-exercise condition and also to exercise without specific cues or with internal cues. So what that suggests is you should work on, with your Parkinson's disease patient or client, is practice walking, practice sit to stand, and give them external cues like, step on that dot on the floor or walk towards the wall or those kinds of things. Lift your shoes higher as you step. So those kinds of things, cues that focus on a result of the movement that bring their attention to a point outside their body. That'll be more effective. The second systematic review I found they looked at home-based exercise compared to exercise done under supervision. And what they found was they were equally effective for Parkinson's disease. And they were looking at balance parameters. So, walking, stationary standing, different parameters around balance. And so home-based exercise can be just as effective. And the third review I found was on mind-body exercises. Now, this didn't include any studies on Pilates. It was focused on yoga and Tai Chi and Qigong. But my gut is we could probably smush Pilates in there quite comfortably. And so what they found was that mind-body exercise does improve, and this was in the short term, like immediately after the exercise session, does improve many parameters of Parkinson's disease. So, they looked at balance, they looked at walking speed, they looked at sit to stand, things like that. So What I would suggest, how do we interpret all of that? Well, I would say that Pilates is really probably going to be beneficial or almost certainly going to be beneficial for your Parkinson's person, and that you should probably include two components within the workout. One should be probably a specific, skill practice of the activities that they need to improve. So walking, sit to stand, balancing activities. But I'm not talking about standing on one leg on a Bosu. I mean like just the sorts of balancing activities that they need to do in their daily life, like standing still on 2 feet on a flat surface for a few minutes while they wash the dishes or whatever. So walking upstairs, walking downstairs, those kinds of things. Practice those using external cues. So focus on cues that relate to the environment, giving them cues about where to put their shoes. Place the sole of your shoe on the second step. Walk towards the wall. Lift the crease of your pants leg higher as you walk. Give them cues that bring their focus of attention outside their body. The second part of the work, or the second component of the workout, should, I think, just be a general Pilates workout, because of that study that review that found mind-body exercise is beneficial. So just do general whole body, Pilates work. Again, I would focus on external cueing during that. So cueing them to bring their attention to a point outside their body, but just work through the Pilates repertoire, within their capability, whatever their level of function and fitness and flexibility is. Give them appropriately modified things that are attainable for them. I hope you find that helpful, and good luck. Tom Fisher says, he has a question about supplements. He says, "Hi, Raf. Here's a question you may be able to answer. It's about supplements for the body. What I want to know is, if you're taking supplements and your body naturally produces what you're boosting, e.g. creatine or collagen or zinc, does the body stop producing the regular amounts as it responds to what's being provided? The body is smart and would learn to be lazy when allowed. Any research to back this?" Well, Tom, I can't directly answer your question because I don't have a deep enough knowledge of the nutrition science, but I can partially answer your question because I know how to look things up. So I did a bit of research into both creatine and collagen supplementation. I didn't get to zinc, but for creatine and collagen, what I found is there's a very comprehensive literature on creatine supplementation. It goes back about a quarter of a decade, and there's a pretty high quality literature in there. And what we've found is that if you take about 3 to 5 grams of creatine per day, it significantly enhances your ability to recover from high intensity exercise. It enhances your what's called power endurance. So basically, if you do a maximal kind of sprint on a cycle for 30 seconds and then have a 2-minute break and then go again, the second time and the third time and the fourth time you go, generally you'll be less and less and less powerful, less speed on the pedals. If you've been taking creatine supplementation for 4 weeks before you do the test, your endurance will be retained much better. So your power endurance will be much better. Your second, third, and fourth trials, you'll be much closer to the amount of power that you output on trial number 1. And it probably enhances your ability to recover from high intensity resistance training and thus to train harder and get more benefit. So it's pretty uncontroversial, I think, to say that creatine supplementation will enhance probably maximal strength training and certainly power training for athletes. And that's at about 3 to 5 grams per day, which you think about like a teaspoon is about 6 grams. So, kind of a non-heaped teaspoon of creatine monohydrate, and it is a legal supplement in just about every professional and amateur athletics and sporting associations. So if you're a powerlifter or mixed martial artist or whatever, it's generally within your association. It's most likely legal, although check that with your association. So that's creatine. Now, creatine is something that's naturally produced in your muscle cells, but what we do when we take supplement is we basically increase the concentration. So you end up having more in your muscle cell as a result of supplementation. It takes at least a few weeks, though, to build up. You can take a much bigger dose, so you can take like 20 grams a day for 1 week and then get the same effect. But then the maintenance dose is about 3 to 5 grams a day, according to most studies. So that's creatine. If it's your goal to increase maximum strength or particularly power, which is basically strength applied quickly, then I would say creatine supplementation is pretty much a no-brainer. It's been, like I said, it's got a 25-year history in the research, so and no, adverse side effects have been discovered. There is, some anecdotal evidence that people experience muscle cramping and things, and I experience that myself from whenever I'm on creatine, I get some muscle cramps. It's more of a kind of like annoyance rather than, anything else. And I pretty much consider it a small price to pay for the increased performance and recovery that comes from creatine. So, hope that helps. Now, as to collagen, this was an interesting one. So collagen is a protein, and it is the protein that makes up the vast majority of your non-muscle, non-fat weight. So, all of your ligaments and tendons and fascia, connective tissue are made predominantly of collagen. And even within your muscle tissue, there is quite a bit of collagen that is, the kind of this forms the structural elements of the muscle, the bits that sort of like form the skeleton, as it were, of the scaffolding of the muscle. And so you use collagen in your skin, like right throughout your body. And so that's the reason for the interest, I think, in collagen recently. But here's the thing. Whole proteins can't pass through the walls of your digestive tract. So proteins are made up, proteins are molecules that are made up of long chains of smaller molecules called amino acids. And in our gut, when you ingest, when you eat or drink protein, you break it down inside your gut into its component amino acids, and the amino acids pass then through the wall of your gut into your bloodstream. And the reason we do that is because to avoid activating our immune system. So basically our immune system recognizes invaders, viruses or bacteria, by the proteins that are stuck in the cell walls of these viruses and bacteria. And so proteins, like when you have antibodies, you say you have an antibody to some virus or something. Well, an antibody is simply a protein that has a complementary shape to the virus protein. And so basically, if we allowed proteins to pass through our gut wall into our bloodstream, we would generate a violent immune response against those proteins because they would be perceived by your immune system as invaders, and you would get a massive immune response. So we don't allow whole proteins to pass through our gut wall. We only allow we break them down into their components, the amino acids, and each amino acid then passes through the gut wall. And then once they're inside our body, in our liver generally, or in our cells, whatever, we reassemble those amino acids into whatever protein we need, and largely collagen. Now, so from a theoretical standpoint, with my understanding of biochemistry, which admittedly is not terribly profound, it didn't make sense then that collagen supplementation would be any different to supplementing with any other protein, because if you ingest it as collagen, the process of digestion actually makes it into not collagen. You break it down into its component amino acids. So all you get in your blood is a bunch of amino acids, regardless of whether you ate collagen or, whey protein, which is the common protein from egg whites. Whatever protein you eat, it ends up just as amino acids. So, to me, that didn't seem terribly plausible that collagen supplementation would have any benefit on anything relative to just eating the same amount of a different protein, because all you're going to get is a bunch of amino acids in your blood. But I was wrong. So the research on collagen is way less. It's way more recent, and it's much smaller body of research than the research on creatine. So I would say the research on collagen is probably nascent. It's just at the beginning, and it's probably too small a body of research to draw any strong conclusions. But there is some promising research. So basically all of the trials that I've found, and I found a couple of systematic reviews and meta-analyses, and all of them seem to find either no benefit or a benefit for both pain, like joint pain, osteoarthritis, and skin health. And so none of them have found that it makes it worse. And all of them find either no benefit or some benefit, and the majority of them find some benefit. So I would say it's early days. There's not been enough studies to really call it a settled matter yet, but the early indications are probably that collagen supplementation has some benefits beyond just eating enough protein. And most of these studies had a dose between 5 and 15 grams per day. The only thing I would say as a word of caution is, because it's early days and there's not a lot of long-term literature in this, or there's not any long-term literature in this field that I found, side effects are unknown. And so, potential side effects might be, for example, like in issues with your kidneys. And I don't know if that's a thing or not, but I'm just saying that with a relatively emerging field of research, those are the things that are yet to be discovered. So, so collagen supplementation, does seem to probably be, something worth considering. Okay, now, of course, you shouldn't take nutritional advice from me because I'm not a nutritionist, and I mean that genuinely. So if you're considering taking collagen, and I don't know what your reasons are, if such is the case, go see a dietitian. Dietitians are awesome, and I see one, irregularly when I have a question about my diet and performance and whatever, and it's always well worth the time and money I spend. All right, I hope that helps. Carly has a question. All right, so this is kind of a long one, so I'm just going to summarize it. Basically, Carly says, all right, I'm just going to read this paragraph out. I'm struggling with reason. If there is no bad or good posture or no particular right or wrong way to do things, then why teach any particular way to do a movement in Pilates? For example, when lying on your side and maintaining that slight gap underneath the waist while carrying out the rest of the side-lying movements, why is that the way to do it? And I don't want to just think that's because the way Joseph did it, or because a lot of what is taught is adapted from those moves anyway. Is there not a better way to do a movement, even when there's not particularly a wrong way? And why is that? Because you work harder and get more out of the movement? I listened to the Good and Bad Muscles podcast. That was one of our Pilates Elephants podcasts. And I understand that just working and moving all muscles is beneficial. All right. So what a great question, Carly. So essentially this is what you're describing is what I think of as a sense of movement nihilism. It's like, well, if there are no rules, nothing matters. What the hell are we doing? Why tell anyone to do anything any particular way if everything just works the same? And the answer is that, well, it depends on what your goal is for, what your participant's goal is for doing the exercise. So I'll give you a couple of different scenarios. So and people's goals, people might have more than one goal, and their goals may change. So the reasons that bring people to exercise initially may change over time, and they may be different reasons that keep them coming over time. So if your goal is to burn as many calories as possible because you want to lose weight or tone up, well, you should, that's, largely to do with programming, and programming whole body movements are going to burn more calories compared to programming isolated movements. But even within a relatively isolated movement, like a side-lying exercise where you're basically just moving your leg, if you lift your waist up off the mat, so you make a little mouse house for a mouse to run under your waist there, well, that is working more muscles. You're working the waist muscles now, and probably the lower hip muscles a bit more as well, so you're burning more calories. So that's a benefit. Whereas if your goal is not necessarily to lose weight and tone up, but to just feel more healthy, well, is there any particular benefit to lifting your waist up? I would say probably not. Doesn't really matter. If your goal is, or if the benefit that people are seeking is to do with basically the mental benefits of Pilates. So basically feeling calm, at one with your body, happy, getting out of your head, essentially getting into a flow state. Well, the way to achieve a flow state is to engage in an activity that is a high challenge, has a high level of challenge, and at which you have a high level of skill. Right? So think about when you're completely absorbed in movement. It's when you're doing something that's relatively challenging and you're relatively good at it, like compared to how challenging it is, you're just good enough, but it's not easy, and you're not so good that it's easy for you. So, that can be, the level of challenge has to be obviously relative to the person's level of skill. So if you've got somebody for whom, just lying on the side and moving the leg is a challenge, well, they probably don't need to think about lifting up their waist, because if you ask them to do that, it might bring the level of challenge beyond their level of skill, and they may actually come out of flow because they'll be trying to think about too many things all at the same time. So that might be a reason to not cue, to lift up your waist in that side-lying movement. Or if you have a more skilled person, somebody who's done it more and is more experienced, well, it might be, if you're just getting them to wave their leg around, it might be too easy for them, and they can do that whilst thinking about what they're going to cook for dinner tonight. So you might need to give them additional challenge, e.g. lift up your waist, so that they have to bring their brain to bear on the task, and that will help them get into that flow state. So, those are the reasons really that I can think of off the top of my head why you would give someone a particular instruction. Is there a better or worse way to do it? Nah, not really. It all depends on what you're trying to achieve. And I think, the vast majority of these benefits will accrue to people kind of just from showing up and moving, right? And so all of the additional difference that we make is a relatively small amount of difference, I think. I think the biggest difference that we make as exercise professionals is helping people get motivated and empowered to show up and do the work, right? And it's just by showing up and doing the work that you get the majority of the benefit. And I think that's the case in most areas when it comes to health and fitness, right? So just say with diet, right? You could think about, meal timing and macronutrient density and, protein timing and fasted cardio and ketoacidosis and all that kind of stuff. But really, for most people, if they just want to lose a little bit of weight and tone up a little bit, probably just being aware of, eating a balanced diet and not eating to being over full is going to give them 80% of their benefit, right? And then it's only people who are, working towards a figure athlete show or a bodybuilding show or a weight class athlete or somebody who wants to be 5% body fat, well, that's when you have to get up at midnight and eat your 30 grams of protein and, have steamed chicken and broccoli for dinner 7 nights a week and all of that kind of stuff. So I think, same in movement, that, the vast majority of the benefit for most people, they just want to feel better, look better, be stronger, be happier, more calm, more centered. Like the vast majority of that benefit accrues from just showing up and moving, right, and having fun. So your job, I think the biggest difference you can make as a movement teacher is to make it fun, is to empower your clients, to build their confidence. And the way you build confidence is you set the bar low at the start, give them early wins. Set the bar low for success. So don't tell them to lift up their waist. Just say, hey, lift up your leg, swing it around. You're doing awesome. Look at the way you're swinging your leg around. That's exactly what I wanted you to do. High five. You're awesome. And that way they enjoy themselves and they feel they're doing a good job and they feel more motivated probably to come back next time. And then next time you say, hey, look, you know what? You're doing so good. I rarely see people pick this up as quickly as you. Are you sure this is your second time only? You know what? I think we could give you a little bit more challenge this time because I think it's going to get a bit too easy for you quickly otherwise. So why don't we think about lifting your waist up a little and making a little mouse house under there this afternoon so that we can just keep you progressing. So that's the way I would approach it. Hope that helps. And don't worry. You don't have to become a movement nihilist. There is a reason for our existence. All right. Louise says, hey, Raf, like yourself, I have a large respect for evidence-based research. However, I believe there are some things that cannot be explained and adequately determined through the scope and limitations of scientific research, especially when the subject matter is as complex as the human body and mind. I would love to hear your perspective on the limitations of scientific research. Many thanks, Louise. Hey, Louise, awesome question. Yeah, I agree 100%. There are many, many things that currently cannot be explained by science. Low back pain is one of them. Human motivation is another one. Behavior change is another one. So there are just huge gaping, holes in our understanding of how the world works, particularly around the human body and mind. Now, I don't think those are necessarily inherent limitations in science. I think they're more limitations in our current understanding. And I can imagine some future time, maybe 100 years from now, when, some of those things are not mysterious to us anymore, when we've peeled back the onion and we understand it. If we think about 100 years ago, some of the things that we didn't understand, like infectious disease, or maybe not 100, maybe 150 years ago for infectious disease, Louis Pasteur. The germ theory of illness is only, from the 19th century. So 200 years ago, we were bleeding people and leeching them. Definitely our understanding is incomplete, and I think that's a temporary state of affairs, and we just got to keep pushing the peanut forwards. And many of these things won't be resolved in our lifetimes, but we move forwards and do the best we can with what we've got. I think I think the philosophical or where I think we do need to be cautious is in going from an acknowledgement that science has a very incomplete understanding of these things, which is 100% true. Science does have a very incomplete understanding of many areas. But leaping from that to then saying, well, therefore, anecdote, intuition, and personal experience are a good guide. And that's a logical fallacy. So now that's not what you were proposing in your question, and I don't know if this applies to you or not, Louise. So this is sort of more of a general point. But, just basically saying that, okay, science doesn't know the answer to this question at this time doesn't imply that somebody's intuition, theory, or personal experience or anecdote does have the answer. Those two things are not logically connected. One doesn't follow from the other. So I think, in those situations where we say, for instance, low back pain or, how do you help someone change their behavior, like give up smoking or start exercising or start eating better or whatever, the answer to that is, well, we've got, science knows some things that help a bit in these areas, but we probably have only solved 20% of the problem at this stage. And I think, what is, the right response there for us is to say, well, we've probably only solved 20% of the problem, and we should just acknowledge that and say, okay, well, that's probably the best we can do right now, right? Is to help you get 20% better, or help 20% of the people get better, rather than fall into the trap of thinking like, oh, well, science doesn't understand it, therefore we should just apply non-science. So I think, science knows, in regard to, for instance, low back pain, science knows some things that help and it knows some things that don't help, but those are just things around the edges. The vast majority of things we actually don't know how to solve for. So I would say, our best way to proceed forth is to just work within what science has illuminated, do the things that we know work, avoid the things that we know that don't work, and then just fill in the gaps. So, but be, I guess, remain humble enough to realise that basically we're just making it up, and that, just because we believe something to be the case doesn't mean it is the case unless it's been shown repeatedly by well-conducted studies. So anyway, I hope that helps. I'm not sure if it does, but that's my best answer. And thanks for your question, Louise. So Belinda says, hey, Raf, hope you're well. Have you done any podcast on sciatic nerve issues by chance, or what exercises help? I think I've developed a rather painful issue with sciatic pain from my left glute all the way down my leg. It's likely coming from my lower back, even though I have no pain in that area. I'm still exercising, lots of loading like squats and lunges. Not sure if that's a good thing, but it seems to feel worse afterwards. Anyway, I just thought I would check as I fear getting stuck down the physio rabbit hole of rehab. Well, Belinda, I am going to join your question with Candace's question, which is very similar. So Candace says, hi Raf, I'm hoping to be able to give me some guidance on Pilates with a psoas injury I've been carrying for about 3 weeks now. I've had 3 myotherapy treatments with 3 different practitioners, and at my most recent treatment, which has been the most effective, the therapist suggested I avoid hip flexor stretches and anything that puts the legs beyond 90 degrees. Up until this most recent treatment, I've been unable to bend past my knees and get up from a seated position without getting stuck halfway. I'm trying to draw on our training, but honestly feeling a little lost as to what I need to be doing. Would this suggest my hip flexors are taking over and that I should be working to strengthen the psoas? I would normally do reformer Pilates 4 to 5 times per week, but I'm struggling with 1 to 2 at the moment without a flare-up. any pointers in the right direction would be greatly appreciated. Now, I did have a little bit of a further conversation with Candice over DM, and this pain came on when she was actually it came on a Monday morning, and when she woke up, and then she thought back and thought, okay, what might have caused this? And she thought, okay, well, on Saturday I loaded 3 big folding tables in and out of a ute and lugged them around, and so it might have been that. And she said she has pain in her low back. What does she say? Pain in her low back radiating down to her hip and her glute and down the back of the leg, I believe, but no numbness, no change in bladder or bowel function. So we've ruled out red flags. So, and the pain for Candice also goes around to the front of the hip. So quite similar symptoms that Belinda was describing. So, Belinda, I think basically everything I'm about to say to Candice also I would say to you. So the first thing is if somebody has a new onset pain, is to rule out red flags. So, was there a traumatic onset? In this case, no, there wasn't, because it happened when you woke up. So that rules out a fracture or something like that. And is there any chance of cauda equina syndrome? So any change to bladder or bowel function, any, numbness in the seat, in your butt, basically, loss of muscle control in the leg, like your foot goes floppy or, you can't wiggle your toes properly, or muscle wasting. So presuming that we don't have any of those things, so that's not the same as pain in the leg. So if we've just totally lost sensation in the leg, or we can't move the foot properly or whatever, that's a cause for concern, and that's a red flag for cauda equina syndrome, and you should go to the emergency room. But in the absence of those symptoms, it is very likely garden variety sciatica, which is just irritation of the sciatic nerve that travels down the leg into the foot. And that irritation can occur in a number of places. It can occur inside the spinal canal, if there's a disc bulge or some other kind of stenosis, spondylolisthesis, some other kind of irritation in there, or just inflammation. It can occur at the nerve root, where the nerve exits the spinal canal. It can occur, outside of the spinal cord, as the nerve travels through the pelvis or through the back of the leg or whatever. So there are a number of places that the nerve could get irritated. Now, Candice, from what you've said, it doesn't sound to me like a traumatic, like even a too much too soon injury. Because when you told me about the, lugging the tables out of the ute, I thought, maybe that could be some kind of a disc, irritation or something like that. But but the pain didn't start till 36 hours later. So that kind of doesn't totally make sense to me. Although, it's plausible, conceivable, should I say. However, like when you told me that you do Pilates 4 to 5 times a week, I think, all right, so if you're used to doing reformer Pilates 4 to 5 times a week, I think lugging 3 folding tables out of a ute doesn't sound like, to me, something that is way beyond your physical capacity. It sounds to me like you're well and truly fit and strong enough to do something like that if you're doing reformer Pilates 4 to 5 times a week. So to me, that doesn't sound like an unusual level of load on your body. And so it doesn't seem that likely to me that it's a traumatic injury. So I guess there are 2 possibilities. One is that it's a traumatic, that's some kind of injury. You've injured a disc, or you've pulled a muscle or something like that. Or the second one, which I think is way more likely, is that it's a pain flare. It's a pain episode. And so either way, the treatment is fairly similar, which is good news. So So the prognosis for sciatica, which prognosis just means like what's likely to happen if left untreated. So basically, the vast majority of people get better within 1 to 2 years. 2 years is absolute maximum. People who have a lot of people get better within 6 weeks. People who have surgery tend to get better outcomes in the short term, like as in less than 1 year, but in the long term, no better outcomes. So in other words, surgery just like hastens the recovery process. It doesn't actually improve your end result. So, unless your symptoms are completely unbearable, I would not consider surgery because there are obviously significant risks associated with spinal surgery. So if it's a pain flare, that would be basically your pain system is responding to a perception of threat to do with certain positions, and maybe that is, some combination of poor sleep, stress in your life, low physical activity, although that doesn't sound like it's an issue for you, and basically, various other sort of psychosocial variables. Or if it's an injury, it might be an irritated disc. It might be some kind of low-grade inflammation in your spine or nerve root or somewhere down through the course of that nerve. And either way, basically the recommendation is to avoid movements that cause intolerable pain, and to keep moving and keep as active as possible within pain tolerance. And you don't need to do special exercises, as in like moving in any particular way or flexing or extending or activating or anything like that. So, as recommended by your health provider, if stretching makes it worse, well, don't stretch. If stretching doesn't make it worse, if you want to stretch, but there's no particular benefit to stretching. And for you, Belinda, with, if you've got exercise that's making it worse, I would back off. I would do less. So don't do none, do less. Or just do different exercises. Try doing different exercises instead of those ones that seem to aggravate it. See if you can find either a lower dose of the same exercise or just a different exercise so that it doesn't aggravate it. And when I say aggravate it, I mean like if you get a bit of discomfort or pain whilst you're moving, that's okay, that's normal. But if it stays flared up for a day afterwards, I would find a different exercise or a lower dose, less intensity or less reps. And then just from there, with patience and a long view, thinking months of trajectory, build it back up. Gradually get back, to work back towards doing those exercises that were aggravating and those levels of reps and levels of intensity that were aggravating, and just gradually build it back up. And whether it's a central nervous system mediated, pain flare, or whether it's a, irritation or herniation of your disc or inflammation in your spinal canal or nerve impingement in the hip, the prescription would be the same, which would be avoid aggravating exercises or movements, okay? But when I say aggravating, I just mean ones that flare it where it stays flared for a day, right? If it gives you a bit of pain when you do it and that settles within an hour or two or even half a day, that's fine. You can do that. But you just need to reduce or change the activity to the point where you can tolerate it and it settles within a day after doing the activity. And then just, adopt a patient attitude and move forwards, within pain tolerance. So, keep doing that for a couple of weeks and then try doing a little bit more or a little bit something different that's a bit closer to the original exercise that aggravated it, and then just move from there. So I would say nothing in particular is off limits. I wouldn't necessarily say don't stretch or don't, move your knees past 90 degrees or anything. I would say if those things flare your pain, yes, avoid them or reduce them to the point where they don't flare your pain. But if there's no particular reason to do them either. So just do what you like doing, but reduce the dose. So if you like Pilates, which it sounds like you sure do, maybe try beginners classes or drop your springs right back when doing, lower body work. Or go to prenatal class or something like that, and see if you can tolerate that. I definitely am in favour of you keeping moving, on a daily basis, but just winding it back and/or changing the particular activities or exercises or positions that you're in so you don't flare it. And the prognosis is excellent. Whether it's a disc bulge or whether it's inflammation in your sciatic nerve or whatever, or whether it's a pain flare, the prognosis is excellent. You're very likely going to recover, and it's just a matter of patience and keeping optimistic about it, and looking after your general health. Sleep, stress, diet, hydration, exercise, all of those normal things, and all of them will contribute to your improvement and recovery. So I hope that helps. That's all we have today. Thank you all for your questions. Thanks for listening. If you have a question, you can email it to me, and we have a new email address. It's AMA, for Ask Me Anything, AMA@breathe.edu.au. Or if you're a present student or past student, you can ping me on Slack or email me direct, and I would love to answer your questions. If I don't know the answer, I will look it up. So I hope you have a great week. Hope you're well. Hope your loved ones are well. And I'll see you soon. Ciao.